Cesarean sections are one of the first surgeries OB/GYN residents perform as the primary surgeon, offering valuable educational opportunities for interns and junior residents to develop foundational surgical knowledge and techniques. In this video, we aim to 1. Identify surgical instruments used during the standard steps of a cesarean section. 2. Describe key features, distinguishing characteristics, and indicated use of each surgical instrument. And 3. Through concrete examples tied to C-section steps, we hope to facilitate OB/GYN interns in creating foundational knowledge of surgical instruments and to support subsequent integration and broader application of these concepts. The procedure begins with incision of skin and subcutaneous tissue. A number 10 blade scalpel is most commonly used due to its large, curved cutting edge, ideal for a large incision. When making the incision, it's important to use the belly of the blade and remain perpendicular to the surface to prevent beveling of the skin edge. Sharp dissection is then carried out through the subcutaneous layer using either the scalpel or monopolar electrosurgery, also called the BOVI, which uses high-frequency electrical current to cut tissue or achieve hemostasis during surgery. There are two functions of monopolar electrosurgery. The cut function, which is the yellow button, is used for precise tissue dissection with less char formation by a continuous flow of current through tissue. In contrast, the coagulation or coag function, which is the blue button, delivers an interrupted, pulsed electrical current that cauterizes tissue and seals blood vessels to control bleeding during surgery. Think blue equals blood. After dissecting through the subcutaneous layer and visualizing the fascia, the anterior abdominal fascia is incised at the midline, either sharply or using the cut function of the monopolar electrosurgical tool. The fascia is then extended laterally on both sides by either blunt technique or, as shown here, sharp technique. A Goulet retractor is used to gently hold the subcutaneous tissue out of the way to improve visualization of the fascia during dissection. The Goulet is a handheld retractor with a flat central handle and two curved ends. Its size and curvature make it a versatile instrument and can be used in delicate and confined areas. Forceps, or pickups, are non-locking tweezer-like instruments that are held with a pencil grip and function as extensions of the thumb and fingers. Tooth forceps, such as the Ferris-Smith forceps shown here, provide excellent grasp with minimal crush injury to dense and fibrous tissues such as fascia. Similarly, Bonney forceps have pronounced teeth and a rigid surface, as well as interior serrations similar to needle drivers to assist with needle manipulation during fascial closures. Due to puncture risk, tooth forceps should not be used on delicate structures such as blood vessels, bowel, or other visceral organs. To dissect through the fascial layer or other dense tissues such as ligaments or vascular pedicles, heavy-duty and sturdy scissors, called Mayo scissors, are used. Curved bladed Mayo scissors, or curved Mayos, are used for cutting or dissecting, compared to straight bladed Mayo scissors, which are solely used for cutting suture, and are appropriately referred to as suture scissors. The superior fascial edge is then grasped with coker clamps on either side of the midline and elevated to separate the fascial sheath from the underlying rectus abdominis muscles. Coker clamps are a type of tissue clamp that feature transverse serrations on the inner jaws with 3 interlocking teeth designed for grasping tough, fibrous, or slippery tissues such as fascia, shown here. The bladder blade is a curved, circular retractor used to ensure the bladder is protected against potential injury when operating on the nearby uterus. The Richardson retractor, or Rich, is another type of handheld retractor used to hold back tissue to visualize the surgical field. It has a right angle with a slight lip at the base and comes in various lengths depending on how deep of a retraction is needed. It is often used to hold back abdominal adipose, as shown here. The next step is opening up the peritoneum, which can be performed bluntly by digital sweeping motion or using sharp technique as shown here. 2 hemostatic clamps are placed approximately 2 centimeters apart near the upper end of the incision, tenting the peritoneum. Hemostatic clamps, or hemostats, also commonly referred to as snaps, mosquitoes, or tags, can be either straight or curved. Hemostats have slender but serrated jaws that allow for a strong, atraumatic grip on delicate tissue or smaller and finer structures. Uses of hemostats include grasping or securing small amounts of tissue or vessels, tagging or marking suture during a case, and are also often used to secure the surgical drape or cords or tubing prior to surgery. The peritoneum is incised using Metzenbaum scissors. Metzenbaum scissors are the other main type of surgical scissors. The fine, curved blade of Metzenbaums are used for precise dissection in delicate tissue. After the peritoneal incision is extended bluntly, a single-use self-retaining retractor, like the one shown here, can be placed, or the bladder blade and ridge retractor can be placed to ensure visualization. At this time, some surgeons will create a bladder flap. Given the delicacy of the vesicouterine peritoneum, Metzenbaum scissors and smooth tissue forceps are used. Smooth tissue forceps, as the name implies, are non-toothed forceps that grasp tissue atraumatically through fine serrations on the tips. The hysterotomy is then created through the lower uterine segment using a scalpel. After delivery of the baby, the umbilical cord is clamped using a hemostat or a Kelly clamp. Kelly clamps have a coarse, horizontal grip similar to hemostats, but are larger in size, making them ideal for securely holding substantial amounts of tissue or vessels. The dense umbilical cord is then cut with curved Mayo scissors or bandage scissors. After delivery of the placenta and removal of any clots or debris, closure of the hysterotomy begins. To provide retraction or aid with hemostasis, the uterine incision can be grasped with the ring clamp, which has large circular jaws with transverse grooves ideal for broad, flat surfaces, or with an Alice clamp, which has a wide, heavy tip containing multiple interlocking teeth. The Alice clamp allows for firm, secure tissue grasping, while its thin grip minimizes crush trauma to the tissue. Needle drivers are the primary instruments for suturing. Needle drivers are distinguished from other clamps by shorter jaws, longer handles, and bidirectional teeth, allowing grip of the needle in various positions. Russian forceps are used for retraction and suturing during uterine closure. Their rough, circular tips provide secure, atraumatic grip over large tissue surfaces. The fascia is then closed. As previously discussed, Coker clamps, Bonney forceps, and Goulet retractors are all used. The subcutaneous layer is sometimes closed next, followed by closure of the skin. Adson's forceps, which are fine, single-tooth pickups designed to delicately handle tissue, are typically used for skin manipulation during closure. We hope this video helps you become familiarized with standard surgical instruments used in the C-section and contributes to your foundation as a surgeon.